Can y'all see that?
Yes. Yeah.
Okay, good. Okay, good. And I can still see you. So,
Awesome.
wonderful.
So,
All right.
I think I would do your introduction a disservice. So, if you could introduce yourself to everyone.
Sure.
Great. Okay.
Absolutely. Yeah. Hi, everyone. My name is Mikaela Frissell. I'm a licensed clinical social worker in Austin, Texas. I work primarily in a musculoskeletal clinic that's a part of Dell Medical School. And I do a couple of things in the clinic, but one of the roles I play is to provide behavioral health services to people who experience chronic pain. Usually, it's people who experience back and neck pain. We may also work with people who experience arthritis and are approaching a surgical intervention or have an injury that they're in the process of recovering from. So some folks are sort of preparing for surgery, and some people are don't have a great resource for or treatment from a biomedical standpoint. And so in this clinic, we integrate CBT services into our treatment. Um, and today I'm going to present on one of the treatments that I use, which is cognitive behavioral therapy for chronic pain relief. All right.
Thank you. Thank you for being here, Michaela. We appreciate this so much.
Yeah. And I heard a little bit at the beginning. I think there's a combination of people who have read the chronic pain management workbook, and some people are familiar with CBT for chronic pain. I think if you have any specific questions to put in the chat, Natalia's agreed to kind of monitor that and sort of pick what's helpful for the beginning, or sort of throughout the presentation, and then also we'll leave some time at the end for some questions too. Um, okay. All right. So to start out with, I just want to sort of set the stage for what we're going to be talking about. And that is this connection between the mind and the body as it pertains to the pain experience. Um, we have a common saying in pain relief treatment that all pain signals are processed in your brain and your nervous system. And these signals can either amplify a person's pain level or they can dampen that pain level. And this is true for for issues that we know have like a structural component. We can point to a place in the body where there's specific damage that's leading to chronic pain. But it's also true when we have migraines or some condition where we can't necessarily point to a specific area or a specific injury that is leading to chronic pain. Um, Oftentimes, we have people who sort of interpret that or may hear that as if there's not something you can see, that means that the pain isn't real. But we approach pain from the idea that all pain is real pain. The source of the pain is some combination of biopsychosocial factors, so biological factors, social factors, and behavioral factors, things like your mood, your emotions, your thought patterns. And so, to give folks the most robust treatment, we have there's this treatment called CBT for chronic pain. And one of the ways I like to think about it is what we're doing with CBT is we're not thinking of it as an on-off switch. We're not either in pain or out of pain or turning on the pain or turning off the pain, but more a volume dial. So if you think like on a radio, something that can turn up the volume and make it louder, harder to avoid, harder to tune out, and things that can turn that volume down, make it easier to fade into the background, be less prominent, but that that different factors may turn ramp up the volume and different factors may turn it down. So cognitive behavioral therapy is a very popular type of therapy. When I was in school for clinical social work, it's kind of one of the few interventions that people get specifically trained on. There's a variety of reasons for that. Um, It tends to be really well researched and studied because it's very structured and concrete. And what we're looking at in CBT is an event or a situation and sort of the cascade of things that happen after that. So an event happens, you may have an emotional response, a thought response, and a behavioral response. And really, any of those can come first. With CBT for chronic pain, we're usually focusing first on the types of thoughts that come up in response to pain. But you can apply this to any situation or any mental health condition, including depression, anxiety, or stress-related disorders. And this is the image of the sort of classic cognitive triangle, the relationship between thoughts, emotions, and behaviors. I also think it's important to say CBT for chronic pain specifically was developed initially by the VA. And so, like any medical setting, it was developed with people who had access to healthcare. It's a particular population of folks who it's been researched with, and they're trying to expand, kind of do more research to make sure, or sort of tailor it to work with different groups and different situations. But you may hear or experience something in this presentation that doesn't resonate with you, or doesn't make sense to you, or doesn't match your situation, and that's okay. That's because CBT has limitations as well. So I just encourage you to take whatever seems helpful to you, what may work for you, and leave whatever doesn't. Okay. So kind of keeping up with talking about cognitive behavioral therapy, sort of what it is, one of the cornerstones of cognitive behavioral therapy is this idea that we all have automatic thought patterns. And this is sort of where our mind tends to go in response to an event that happens. This is a list of some of the 6 or 7 of the most common types of automatic thoughts, especially when we're thinking about pain. But those are things like catastrophizing, thinking in terms of should statements, all or nothing thinking, overgeneralization, jumping to conclusions, emotional reasoning, and disqualifying the positive. And when you look at these, you see, wow, these are all pretty negative, right? That these are all kind of negative habits of thinking. And that's not an accident. I put this image here to show, kind of illustrate why our brain kind of holds on to negative situations like Velcro. So that's the Velcro on the shoe. And it tends to not hold on to the positive experiences as much. It's more like Teflon, right? They don't stick as much. And that really goes to thinking back to why we have to make these quick interpretations when things are happening around us, right? We have to stay safe. Our brain needs to be vigilant in order to keep us safe. And so if we can interpret things in a way that enhances or is aware of the risk or the danger, then we're more likely to do things to keep us safe, right? We may not take the same risks. We may not, we'll remember last time something went bad, so let me learn from that again and not do it again. Problem is, for a lot of situations, we don't need to have that same response every time, right? We want to learn from the past, but we also want to be open to new things that can happen, new neural pathways that can build up. And so we have to be a little bit more intentional about figuring out what are some countering thoughts we can have when we tend to automatically assume the worst outcome is going to happen, or that we are sure that there's going to be a negative event based on what's happened in the past. So we all tend to think, have certain negative thought patterns we fall into. Definitely life events, relationships, different factors kind of can make it more common to have certain types of thoughts, or more negative thoughts, harder to develop positive thoughts. But the point I really want to make is that this is not a judgment on a particular person. It's not even saying like bad negative thinking is a problem or something that a person's done wrong. It's more saying it's a natural feature of our brain's protective system. And that we need to build up the neural pathways associated with positive thinking and more hopeful thinking. Any questions on any of these, Natalia, or anything before I move into more focusing on the pain?
I don't have any questions. I do wonder if anyone, if this not triggered but brought something up for people about automatic thoughts, like if it made you think that there's a certain automatic thought you always go to when you're in pain or something. Just sharing, just to share.
I'll weigh in on that. Yeah, I mean, my automatic thought is always sort of catastrophizing and thinking that things are never going to get better. But having done CBT before it, I learned coping strategies for that. And then the shoulder pain that I was having did eventually go away. So that was a nice reinforcement to when I have pain now to realize that, those thoughts are not true necessarily. And just on about disqualifying the positive, I've learned that, keeping a gratitude journal, or at least even something informal, like at the end of the day, trying to think about the positive things that happened that day, really help kind of reframe your thinking away from the bad and make you notice and think about the good things, which is very helpful.
Yeah, I would
Yeah.
agree with Lauren. When I've gone back and like read journals and seen the positive, you forget it, when you're suffering for long enough. So I definitely agree with you on that one. I don't know what category it would fall into, but I know for me, when I'm like in bad pain, I just feel like, haven't I had enough?
Mhm.
Like again, like it just, I don't know what that's called, but um, I do like before how you said for some people it's difficult to think, oh, I'm just gonna think positive. That's difficult for me. But
Sure.
in thinking of it in a way of, okay, I have all of these negative thoughts. Let's assess which of these negative thoughts are reality or just my emotion playing tricks on me. So I like that approach. And I just wanted to say that out loud for anyone else that might have wanted to hear that.
Great. Yeah, thank you for that. And I think that's really an important point. This isn't about putting on like rose-colored glasses or denying that living with chronic pain is really uncomfortable. It's not easy, and it's not, if tell patients all the time, like if you could just think differently, you would, right? That it takes some work to start to become aware and think differently. And we're going to go into sort of how we do that. Um, but definitely, emotional reasoning, can, if you start to feel really down or you're feeling really hopeless about the situation, then that everything that you encounter gets filtered through that lens for sure. And so I'll go on to the next um, slide because we're talking about this already, but we take that sort of classic CBT triangle and we layer onto that increased pain. And I think it's important to acknowledge too that because all pain is processed in the brain and our thoughts and emotions are also processed in the brain, that's why these pathways get set off together. So difficult emotions or stressful situations are going to lead to behavior changes, and that's going to kind of cascade into what's happening with the pain signals in your brain. Um, the pain related thoughts that you have are one of those things that tends to dial up the pain. So we just take that CBT and layer onto it the experience of having pain. So one of the skills we use in CBT for chronic pain is to track and balance your thought patterns. That starts with awareness. So that means starting to notice what automatic thoughts about chronic pain you may have, as well as what are some of the specific people, places, or situations that trigger pain. And I heard you saying, Natalia, at the beginning that the weather, right? For a lot of people, the weather is a trigger. And it's important to also say, like with pain, we don't fully understand chronic pain, how and why it develops for some or not others. And I think you were saying we don't fully understand exactly why the weather is such a factor for some people, but it certainly is something that people notice. And so, we may know, like, okay, when the weather's really bad, I know I'm going to have this experience. Well, just being aware that, yeah, it's raining out today, that's going to raise up my hypervigilance, my brain's going to be a little bit more on edge because I know that that's associated with pain. And the first thing you can do is just recognize that and accept, sort of normalize that that's one of the things that happens for you. Um, and then, so becoming aware of the triggers and then the specific thought that may come up. Um, and then the next step is to start to question some of those beliefs. You can ask yourself, is this based on evidence or on habit? And that doesn't, mean is it real or fake, but more, is this what I'm experiencing right now, or is this what I'm expecting based on the habits of my thinking, what I've experienced in the past, and is not necessarily kind of what is happening right now in front of me. The other thing you can think is, what is this line of thinking helping me for? What is it doing for me? Is it cautioning me that I need to kind of slow down or take more, take more rest, be more balanced? Or is it just kind of a habit that I get into because it lets me, not do something, or, validates my desire to avoid something? So again, I want to emphasize, it's not really about any sort of judgment about right or wrong or even good or bad, even though we're using the terms positive and negative, but really sort of what's the evidence and what's the basis of it. Once you can analyze that and think about that, then you can determine, is this a helpful thought that I need, or is it one that I can balance? Is there a more helpful, compassionate way I can think about what's happening to me in the moment? And so there's lots of thought trackers out there. There are even some apps that will kind of prompt you through this process. But this is sort of one of the classic exercises in CBT, where you either throughout your day or at the end of your day think back on some situations that may have triggered a particular thought, and analyze that thought with yourself. So the example of, your favorite band is coming to town, you want to buy tickets, but the last time you went out to a concert, your back hurt for days. What that might do for someone is think, I shouldn't go because I'll pay for it later and I won't have a good time. I can't do things the way I used to, and so I don't want to go to the concert. Think about the emotional response to that. Someone may start to feel really sad or angry or disappointed. Again, those are all valid emotional responses, right? It is disappointing to kind of have that thought or have had that experience. You may feel sad. What it does is then, look at the behavior. That's things like avoidance, maybe isolating, not doing things with friends, maybe not buying the ticket, and then that day deciding, oh man, I really wish I could go. So sort of just taking yourself out of the equation before the event has even happened. And when you do that, you can try on a balanced thought, right? This is prompting you to, if I were to think about this in a different way or tell myself something else about this experience, this event, what is something else I could tell myself? And that's where you can try on a balanced thought. So an example could be, it is important for me to go. I can try to go and be aware of my needs and leave if I need to. It can be something like, I really wish that I could go, but I'm going to stay home and have friends come over and listen to them again. So it's not always just countering that specific thought, but trying to identify, is there another type of thought that you can have in the moment? Any questions about that? Um, so, one thing to do is to get a sheet of paper or a log somewhere and kind of track these throughout your day. The other thing to think about is kind of doing this with a lot of curiosity and interest and kind of getting to know yourself, your habits, your types of thoughts, and not, sort of not being hard on yourself for how you're doing it or how you're thinking about it or what those automatic responses may be. Sometimes I'll have patients who start to then label themselves, oh, I'm doing that catastrophizing again, right? And that's a really hard, this is a tool, it's a skill. It's not something to sort of point out how much you do wrong or how negative your thinking is. So that's just another point that if you do this, it really is about exploring yourself and your experiences, because the more insight you have, the more choice you have, and sort of how to do things either differently or in a more supportive way. All right. Another point or another skill that's a part of CBT is developing either a helpful personal statement or a mantra that sort of um, you can use when that automatic thinking comes up right away, right? Like I said earlier, we just have this Velcro Teflon situation happening. And so when you start to feel pain, you may automatically go to a thought about more damage occurring, that you'll never improve, that you're helpless. Again, it's your brain trying to keep you safe. But if you can identify that, and have a statement that you've already planned, that you kind of know, this is what helps me to feel more empowered. This is how I want to think about the situation when I find myself in pain. It can help to you're not having to think about that in the moment of discomfort, but you kind of already know. I'm going to tell myself, this too shall pass. I am stronger than my pain. I am in control of my mind and my body. Pain is a part of me, but it does not define me. And you can kind of hear when you read those, or if you tell yourself those events, that they just bring up a different response to the situation. Okay. Another skill that's critical to CBT for chronic pain is called behavioral activation, or there's an author who calls it getting good at feeling good. And this involves deliberately engaging in activities that promote positive emotions and sensations. And the key is to approach these activities with mindfulness, mindful presence, rather than going through the motions or rather than trying to solve a problem. We want to shift away from thinking about the pain as something to avoid or a problem to solve and start to think about what are things that help me to feel good, even if, or regardless of what is happening with my pain. So some of the areas to focus on are any movements that can create positive sensations and reconnect you with your body in safe and pleasurable ways. Should the focus on feeling good, not on solving a problem? So sometimes I'll tell patients, do you really like lifting weights, or would you rather do yoga, right? Like, what are the activities that make you feel good, that you enjoy doing, not because you're trying to change your body in some way, lose weight. The doctor told you should do it, but there's maybe a space for some of those activities. But for this, we're really talking about what are things you can do that just sort of generate a positive feeling in your body. And Natalia and I were talking earlier about that may include for some people resting, right? Maybe you are being really mindful of the way in which you are lying in your bed, you know, petting a cat, kind of whatever kind of helps you to feel, whatever movement just really lets you feel good and focused on those positive sensations. Um, the other area is hobbies. So, whatever hobbies that you can do that light up those positive neural pathways in your brain, right? That make you feel like, oh, I just enjoy doing this. It brings me joy to play this music or create this craft or this art or play this game, talk with this friend, any hobby that helps you to feel good. And then the other is social connections, meaningful social connections, interacting with others, noticing, who are the people that you can go to if you're not feeling great or if you are in pain, who can share and be a little bit vulnerable with about what's happening, what your experience is, helps you feel more connected, more seen, and has a really positive effect on countering pain.
I'm just gonna read. So Sandra said that exercise is good, but that it fires up her nerve pain more.
Sure.
I can agree with that, but my turn on that one is when I have like body pain or nerve pain from exercise, I feel I'm reminded it's because I was doing something to help myself to be active, to, as opposed to sometimes when the nerve pain is just coming from the weather, I'm just laying there like letting it happen. Like, why is this happening to me? Whereas like my muscle pain is going to be like, yeah, I did something. I did a thing, so
Yep.
that's okay.
And that's a really good example of how the context matters, right? If we have a narrative or a story that makes sense to us, right? Okay, I, lifted something or I did yoga yesterday for the first time in 6 months. Of course, I'm a little bit sore today versus it just came out of nowhere or it's a trigger, right? That kind of having that's one way that your mindset, kind of what you're telling yourself can impact what the experience is like. And then, movement, it says in here, starting with brief periods and gradually increasing your engagement as tolerance builds is one strategy that we integrate into CBT for chronic pain. If there is, specific exercise that a person wants to do or has been told they need to do, like with physical therapy, but that is associated with pain. And that is one is just starting low and going slow. So, not doing the full 25 reps from the beginning, but maybe starting with a few, taking a break, going back and adding slowly over time. And the other is exactly like you're saying, Natalia, having this mindset or a mantra that one thing we say in CBT a lot is hurt does not equal harm. And if you can reassure yourself that, yes, this may hurt, this may fire up this process in my brain, but that's not the same as doing more damage to my body or harming my body in some way. That can lead to a different experience in how you approach that and sort of how long that pain lasts because your hypervigilance, your threat system isn't as ramped up. Does that make sense?
Mhm. Yeah.
Okay. So another skill in CBT for chronic pain is cultivating the relaxation response. We know that when we are really stressed or we're just sort of going through our day on automatic pilot, we tend to build up tension in our body. And so having a really intentional practice about doing something that activates your relaxation response is essential for CBT for chronic pain. Those are going to look different for everybody. I know sometimes I'll have patients who have a very strong response to the term meditation or to sort of sitting still or being in silence. And so it doesn't have to look like that. I know in the image that's what it is, but can look like there's lots of different types of breathing techniques, diaphragmatic breathing through different nostrils, like alternating your nostril breathing, um, anything that kind of just helps you to get that deep breath in and out does signal to your brain that you're in a place of safety, that there's not something that you need that fight or flight response for. Other For other people, it may look like guided visualizations. So imagining yourself in a peaceful setting, picking an image that you associate with feeling good and brings about that physiological relaxation response. That can also be very relaxing. And then another one is sensory grounding. Some people really need that. They need to touch or they need to feel something to get that soothing relaxation response. So it can be something hot or cold, holding ice or touching warm water, smelling essential oils, listening to music. I mentioned earlier petting a cat, right? Something that feels really nice on your hands and promotes that calming response. Um, these are going to interrupt that stress response that often triggers or amplifies pain, right? So if you're already in pain and then you're not breathing deeply, or you're very you're holding a lot of tension, or you're having really negative or images that are distressing, it's going to like throwing gasoline or really like ramping up the volume. And so we want to do things that'll help counter that. And so towards the end of CBT with patients, we'll put everything together into a plan. And the idea of this is that we want to kind of have a pain plan that we've come up with before there's a lot of pain, because we don't do our best thinking when we're in active pain. So identifying some scheduled activities that you can do. So you know you're going to have some enjoyable, pleasant activities on a regular basis. Practicing relaxation exercises early on, knowing what works for you, identifying that mantra or that coping thought or mindset that's helpful for you. And then the other thing I always tell patients is revising as needed. So, what worked for you for a while may need to be tailored to a different situation or may not work in the same way. So identifying other things that you want to try or add into the plan. And then recognizing that we are human beings living in a very stressful world, a lot of information coming at us all the time. What's happening in our life, stressful situations, any sort of transitions, relationships, those things are going to be triggers for some of the tension inducing responses in your body and may lead to pain. So just kind of noticing if you're feeling a lot more pain or something's happening, and some of your skills aren't working in the same way, zooming out and seeing, is there something happening in my life that may be contributing to this nervous system activation that's amplifying my pain. Substance use, being aware of how alcohol, drugs, or nicotine affect your body. If anything, for some people, it's gonna make things worse. It may interrupt things like sleep too, which is really essential to taking care of your nervous system, is that you get good sleep. And then the other thing I've always talked about is body image, that if you sort of struggle a lot with negative beliefs or thoughts, or have heard negative things about your body, that it may take a little more work kind of to unpack some of those, but that often kind of whatever beliefs you have about your body are important for thinking about how you're thinking about your pain. Um, so, like I said, learning to manage your pain is most effective when you're relaxed and not in the midst of a pain flare. Coming up with a plan that addresses all of these skills. And then I have on here just a couple of resources that might be helpful. One is some things for relaxation and mindfulness, some guided activities, some pain education resources for just understanding a little bit more about chronic pain. And then I also have on here some places where you can find therapists, get connected with a therapist anywhere in the country, who may have training with CBT for chronic pain, and be able to guide you through some of these activities if it's something that you feel like would be helpful. And I will send these. I have these listed. I'll send them to Natalia to share with everyone, as well as a just like a one-page description of CBT, kind of over an overview of what we talked about today, and then one of those thought logs as well. What questions do folks have about anything I talked about today, or questions or reactions?
I like the mantras. I've heard of them, but I've never really used them. And I think it's something that I need to start using for a number of reasons.
Yeah.
How do you approach patients that have chronic conditions that are not going to get better? They're not going to heal.
Yeah.
And in fact, as I'm in my mid 60s. As I age, some of the conditions are worsening. And sometimes, the pain is worse. So, how do you develop positive thought patterns when that's going on?
Um, I think then we'd think about what are ways of soothing yourself, right? Acknowledging that this is that you are in distress, that things don't feel good, and there's not a clear path towards a cure or sort of getting over the condition, but learning to tune into what are things that are soothing for you, what are positive experiences or moments you can build that again sort of turn down the intensity or the focus on the pain, and help you to distract from it for a little bit, or just feel less distressed by it. And that's where I might work, and where I often will work with patients on identifying, which of these skills, right? Is it activities? Is it relaxation? Kind of which area seems the most, like connects with you the most, and is a place to start trying to relate differently to this experience that may not change.
Okay, thanks.
Yeah. And I want to also just say along that this is not in an alternative to medication or PT or anything like that, right? This can be used in conjunction with other types of interventions or medicine or anything else that, again, that helps you to get relief. It's just one way of also dealing with the emotional and behavioral aspect that sometimes isn't always addressed by things like PT or medication.
Right.
I'm a big believer in the relaxation techniques, especially at bedtime. I have a diffuser on my nightstand that I could put essential oils like lavender, different scents, and then I have a spray that's actually it's like a relaxation, a sleep for your pillow. So sometimes I'll use that, and definitely the breathing
Great.
in deep for 4 and then exhaling for 6 slowly, just to
Yeah.
try to calm your body down. And just sometimes I just let my body go limp and feel like I'm sinking into the mattress to try to relax.
Great.
So yeah, those are a big help.
That's great. It sounds like you've done that. We're already kind of knowing, okay, these are things that tend to be difficult for me, and how do I get tools, right? How do I kind of compile my toolkit for pain? Because I know there're gonna be times where I can't sleep or where there's tension,
Yeah.
and you have those tools ready to go. That's really that's the key to this, is kind of not letting identifying where you have some control.
Yeah.
And yes, I love the smell of lavender too. It is very calming.
What I've done, what works for me is first I identify my source, like where is this pain bothering me? That's the first thing I do. I acknowledge that they exist, and I actually give her a name. It's like it's a she. It's a she, and the Oompa Loompas, depending on how intense
Yeah.
they are. And so I let them go ahead and do whatever it is they need to do. But the next thing I also do is to reassure myself that I am in a safe space. So why are you acting out this way? Like we're home or wherever we are, we're in a safe space. We're not in a place where there's a lot of things coming at us, and so we have to tense up. So relax yourself, calm down, let's have a conversation. Why are you bothering me? And when I'm home, it works sometimes. Last week when I was in physical therapy, my therapist can see that I'm spasming, and he's like, "You're really uncomfortable." I said, "I'm not uncomfortable. I'm actually in a lot of pain." And on a scale of 1 to 10, I'm at a 7. He goes, "Oh," and I was like, "Yeah, but I'm not letting them keep me out of physical therapy. So I'm going to do what I got to do today." And at one point, I just said, "Listen, ladies, give me an hour. I need to take a break. Go on lunch. Go to lunch. Come back. Give me an hour. I'll be back home, and then we can have a conversation." And it worked for about 45 minutes. I was 15 minutes short, but when I got home, it was like, "Okay, so you said we're home now." Wow. And I was just like, I did say wait till we get home, and you did. So now let's have another conversation. So it's like I have these conversations, and I do a breathing exercise so I don't fight it, because for me, if I tense up, I feel like it hurts more.
Absolutely. Yeah. Yeah, that tension is sending that signal, that danger signal to your brain, right? When we get really tense, that's sending that signal, and so your brain responds with pain. Again, it wants to keep you safe. And you said something in there, Michelle, that's also sort of classic for CBT is, if you can't think of something else to say or can't restructure a difficult thought, talking to yourself like you would talk to, some people say talk to a friend, right? Your best friend. Or I like to also say, talk to yourself like you might talk to a little kid who is having a hard time in front of you, right? And you probably would say, "You can't scream and yell out here like that. We're going to take care of you so when we get home." But right now, and that just when you talk to yourself in that way, you really do reassert that you are in some control. You're not helpless, and just like when we're little kids, or we need our friend to kind of be there for us, you're being there for yourself and in your mind that way.
Yes.
Any other questions?
I'm going to venture out to ask the book club participants if they would like to engage. And perhaps, I know for me, it was really helpful to learn what my triggers were first. And so I don't think I was aware of the thought patterns that would come up during my pain flare-ups. And um, it was helpful to learn what those triggers were, which for me is weather and stress, for sure. I did come up with personal mantras. I did learn that during our time reading the book, like to speak to myself, like if the way my best friend would speak to me, because I'm much meaner. Um, and also when I'm like having like a bad, like an anxiety attack or something like that, because I just can't get the pain under control, like I start to tell myself to breathe, but I do it like with my childhood nickname and I do it in Spanish. So it's like my mom. And that helps a lot. So I don't know if anyone else like has like thought patterns that they recognize from when they have pain flare-ups and maybe mantras or things that they did to help. No?
Maybe trying to think of being somewhere else, like on a beach, and then you visualize the ocean, the waves coming in and out, just to get your mind off of having that panic attack, which I've had a couple of them. They're not fun. And just to get your mind off of what's happening to you in the present moment.
I do the same thing, Sandra.
Mm-hmm.
Yeah, it seemed like a pretty consistent feeling in our book group that like not focusing on the pain was pretty important. Like a lot of us felt that doing distracting, enjoyable activities was a really good way, at least to sort of temporarily, refocus yourself away from the pain, even though it comes back when you stop doing those activities, but at least it sort of gives you a break, and then you can start trying to implement some of the other techniques, like especially stress management. That's a big one for me. I definitely find when I'm stressed that my pain level goes way up. So
Yeah, and it helps. I think she uses this term in the book, like that, like there's sort of like default mode, right? If you we kind of fall into that, or maybe autopilot. I don't remember what she calls it that, but that we kind of if we're not making time for some of those pleasant activities or de-stressing, that we're never getting to build up those other neural pathways or ways of thinking, or experiences.
Yeah, I know we definitely discussed like how bizarre it is. Like you can be like raging in pain, and then like if I'm out to dinner or in a movie or something, I don't feel it, and then I come back home and the pain is right back, and I'm like, wait, am I making one of these up? You'll start to feel like we're making it up, and but it also I think shows like the power, of the distraction or the positive thinking or. So definitely. And I don't know about like anyone else, but I get very frustrated that like if I'm like meditating or doing breathing exercises like in a group setting, like when it's guided, um, for instance, like I do it with Cat on Mondays, and I will fall asleep within 5 minutes of that woman talking. But I could try and listen to something like alone in my home, and I'm like, okay, like for a half an hour. Like, what is it about like that herd where, where if I'm surrounded, it's like, what is that?
I mean, I'm not sure, like, but if it's maybe one is just a different something about the group makes you feel really safe. I mean, I hear that, I think of safety, right? That maybe being with other people um feels particularly safe to you, and so you're able to fall asleep, um or again, association, right? Every time I do it, I fall asleep, so you fall asleep. Whereas at home, it's a different experience.
Yeah, you're right. Yeah, I've probably told myself enough times, you're not good at meditating. So, yeah. Um, does anyone else have anything they want to share? Any personal mantras that have worked for them? Anything you've learned? Want to learn more? No? Okay.
I shared this in a book club meeting, but I had a yoga teacher once who, in her guided meditation, she would often say, everything is completely perfect right now. And I thought that was the craziest thing to say, especially to somebody with a spinal cord injury. But I realized that at that moment, everything was okay. And so sometimes it helps me to go in the present and try to just kind of just tell myself, it's okay. Right now, you're okay.
Absolutely.
Yeah, I'm with you, Sarah. Sometimes in those moments, I have to be like, your mom is okay, your sister's okay, like you have a place to live, you have food to eat, like you have some, like yeah, I'm totally with you on that one. I have to do that often.
Yeah, and I'm not sure if y'all talked about self-compassion. Again, I don't remember if she talks about it in the book, but that's a way of, this a big thing in CBT or therapy is this idea of both and, right? Both being um, aware of how difficult things are for a person or in that moment, and like you exactly like you're saying, Sarah, in this moment, I have what I need. I am okay. Things are okay right now. Um, that it's sort of not that one or the other, but that there's room for both. Um, and that you can be compassionate for yourself either way. There is a really good book about self-compassion, um, that kind of guides you to kind of thinking about being compassionate for yourself no matter what's going on.
That can be harder said than done.
Absolutely. There's a therapist here in a psychology professor here in Austin who's made it her whole career. She has a website and books and like you're saying, like you have to cultivate it a little bit to do it right some of the time.
Hmm. Hmm. Cultivate it. You made me think about my plants. Maybe I should be as patient with myself as I am with my plants. Okay, well, if you don't have any more questions or anything, going once, going twice. Oh, all right, Mikaela. Thank you so much. This was
Thank
really, really
you.
great. I'll make sure to share all of the resources with everyone that RSVP'd once we get them. And just a million thanks. Thank you for doing this.
Thank you for the opportunity. Thanks everyone for sharing your experiences and your questions today. And yeah, if there's any questions or anything comes up afterwards, Natalia, let me know.
I shall.
Okay,
Thank you. Thank you. That
Thank
was
you.
great.
These were
Thank
great.
you. Yeah.
good.
Thank you.
Thanks everyone.
Thank you.
Yeah. Take care.
Thank you.
Thank you, everyone.
Bye-bye.
Have a good evening.
Bye.